Okay, I will talk about AI and normative modeling in the diagnostics of brain disorders. And what is the motivation for this? Well, first of all, as we have heard in the other talks, brain disorders, and particularly, well, in this context, mental health problems are a big burden to the society, in addition to the human suffering. So it's been estimated that mental health problems cause more than 600 billion euro costs annually within the European Union plus UK. So we are really talking about a lot of money here. It's been estimated also that it's more than 4% of the GDP of these countries that go into the problems caused by mental health. Unfortunately, the diagnostics and particularly finding the root causes is difficult. It's not always, but quite often that's the case. And there are a couple of reasons to that. One is that the symptoms that we observe externally, and then the brain state that underlies them, there is no one-to-one mapping between the two. We can have the same kind of symptoms for different changes in the brain, and also vice versa. Also, we have quite a bit of individual variability in these symptoms and also in the brain states. Now, one could think that brain imaging would be a good tool. Of course, Hanna was just before me showing that indeed it can be used to treat, not to treat, but to diagnose brain disorders. But we feel that there could be more to it. Now, the problems of using brain imaging in such diagnostics is that it has limited availability. Again, this individual variability in the measures. And then we actually don't know too much about how the measured data actually reflects brain function. Of course, there is quite a bit of knowledge, but still a lot to be discovered. So now, how do we make brain imaging more useful? As Hanna also argued, if we could collect large data sets of brain imaging data and then aggregate or put them together and use these big data approaches, so that would likely be useful. And then how to do this in more practical terms. So now, if we have such a large collection of data, we can also establish models that capture the individual variability in these brain signals. And with that, we can establish a normative model which tells how the healthy brain works, what is the statistical boundary within which most, say 95% of the healthy population are. So this is very similar approach to the growth curves that are available in the healthcare system when following children to grow and to see if there are any abnormalities on the way. So then the third point after establishing a normative model is then to use AI tools to detect that which people, so which data sets might be outside of this normative range. And this approach as a whole could lead to establishing biomarkers for diagnosing brain disorders. And I will deliver some examples of what we have done in this respect. But before that, we have an initiative that was supported by Helsinki Brain and Mind to collect large brain imaging databases. So there is a web portal to that, to which researchers and clinicians could load these data sets, and then it can uploading can even trigger automated processing. There are some legal hurdles in doing this, so this is more a proof of concept at the moment than reality. The method that we have been focusing on is the same that Hanna was talking about, so magnetoencephalography, or MEG for short, that measures the magnetic fields that are generated by electric activity in the brain. And MEG is really good at studying brain oscillations and also functional connectivity between brain regions. This is an example of the inter-individual variation. So what is plotted here is the frequency of the so-called alpha rhythm of the brain. So it occurs at about 10 Hertz, and it's known to change, to slow down when people age. So here on the vertical axis, you see the peak frequency, and then on the horizontal axis, the age of the participant, and each dot is then representing one subject. So on average, it does go down, but say that if you have detected alpha at 9 Hertz, so here, the participant's age can actually be anything from a little bit less than 20 to above 80 years. So the variation is so large that you can't, on an individual level, you can't really tell much about the age. If we look at another cortical region, the same thing, the 10 Hertz oscillation frequency also goes down, maybe a bit less with age, but again, we have quite a bit of variation there. Now, how to do this normative modeling on more practical terms? So here is one recipe to do that. We first record resting state MEG in a large population of healthy people. Then, based on the recordings, we estimate what is the activity in the cortex. So we do so-called source estimation. Then we estimate or calculate spectra. We could also calculate something else. Hanna was mentioning functional connectivity metrics. That's another possibility. Then we collect these metrics across the population that we have measured, compute the mean and variance, and thereby we get an average value for that metric for each frequency and for each cortical location, as well as some indication of the distribution or variance. Now, to show how this works in practice, we had data from mild traumatic injury patients. So this is a condition that is quite difficult to diagnose because the mild version of brain injury doesn't show in structural imaging. So for example, the MRI is normal, yet these patients complain about cognitive problems. They say that they can't focus anymore, they can't concentrate for a long time, they might have memory problems and all that. But these are all subjective reports, and there has been no way to objectively tell that these people are suffering from some medical condition. So we applied this normative modeling approach, and by that we can, for example, look at how reliably or how significantly the oscillatory activity deviates from the normal population. So what is plotted here is the t-statistic, so a statistical variable telling how significantly activity at different frequencies at this location where the blue dot is on the cortex differs from the normative sample. So we can see that in this mild traumatic brain injury patient, activity around 20 Hertz is significantly higher than in the healthy population. Now we can take this approach, apply it to all cortical locations shown here in this matrix illustration across all frequencies. And what is color-coded here is the, say, deviation score, the so-called Z-score, that how much more or less of this activity at that location the patients have compared to the normal healthy population. We also had control group, which was not in the normative model, so their scores are close to zero, as they should be, and the patients have, in certain brain regions, they have clear differences compared to the normal population. So now we can take these features, look at their significance in classifying these traumatic brain injury patients versus normals or healthy people, and we can see which brain areas, which frequency bands contribute to that classification. And also visualize them, so in the theta range, so that is from 4 to 7 Hertz in the brain activity, and then alpha around 10 Hertz. So these illustrated regions are the ones that deviate the most. So we can then train a machine learning algorithm to classify these patients from the healthy controls. And by doing that, we get about 80% classification accuracy. It might be unrealistic to aim at 100% because, as I said, this condition is difficult to diagnose, and thereby we don't have very reliable labels to the data. This was also something that Johanna was pointing at in her presentation earlier. And this is a problem with many of the methods that we are developing for diagnostics, because the cases for which these methods are needed typically do not have any other method, and thereby we do not have reliable labels. Then switching gears a bit in terms of the metric, as Hanna also mentioned, functional networks, so connections between brain regions, are very important for many, or if not all, of our cognitive functions. And now, if these networks are disrupted, so that typically leads to brain disorders. As I mentioned, MEG is particularly suited for measuring these kind of changes in brain networks, and it does make sense to use it to derive connections between cortical regions. This is again from a fairly large data set of 650 healthy people in different ages between 80 and 88 years of age. And again, resting state MEG recordings were done. And well, I spare you for the technical details of what we did, but what is shown here is just how the cortical surface was divided or parceled into regions. And then we estimated the connectivity, functional connectivity between these regions. And then this is now shown here in this circular plot, such that the left hemisphere is on the left side, right on the right side, and then back of the brain is the bottom, and so forth. Now what is plotted here is not exactly the connections as such, but it's the change of the connectivity with age. And now the bluish colors mean that that connectivity decreases with age, and then the warm colors mean that connectivity increases with age. You can see that most of the areas become less connected with age, but the frontal areas in particular, their connectivity increases a bit. This is just to indicate again that within the healthy population, there's quite a bit of variation because age is a factor. So we need to take this into account if we want to establish a normative model for functional connectivity between brain regions. This illustration here on the left is the same data, same result, but just now shown spatially that which areas are reducing in connectivity when people age and which are increasing in connectivity. So disruption of these connections between brain regions or connectivity-related brain disorders, of course, then in the end at least, they lead to decreased functional connectivity. But as Hanna pointed out in her presentation, there actually can be a transient increase in connectivity because of compensatory mechanisms in the brain. And as I showed, healthy aging also brings about connectivity changes. So we would need to have a normative model also for connectivity. So to conclude, normative models and AI could be useful in the diagnostics of brain disorder because that's the way to capture inter-individual variability in these metrics. And we can then express all these differences as statistical variables instead of absolute differences. And then these could be used as more robust features for AI-based classification or regression algorithms. And this then could help in the derivation of biomarkers that are specific to a certain brain disorder. We achieved a pretty good accuracy in detecting mild traumatic brain injury, but this approach could probably be generalized to other brain disorders, and of course, including also those that are causing mental health problems. But this is something that is yet to be demonstrated. So I thank you for the attention and end here.